Hi, this is Russell Smoldon, and I'm working on a very important piece of legislation at the Arizona Legislature. It has to do with fair access to cancer treatment. The FACT Coalition is made up of the Leukemia Lymphoma Society, Arizona Cancer Society, several other patient providers, including doctors groups, nurses groups, hospitals, all looking to forward the technology associated with the oral parity of cancer treatment drugs. We're in a battle with the insurance company and the insurance companies and insurance lobby in regards to how oral medications for chemotherapy are treated. Currently, most plans cover an IV application of chemo treatment, but over the last 5 to 7 years, oral chemo treatments have become more readily available to consumers. We believe that patients and doctors together ought to decide what's in their best interests in terms of the type of chemo drugs they take. There are some exciting new technologies involved in oral chemo. There are drugs now in the leukemia market specifically that create a death sentence into a chronic disease just by taking a pill once a day. There are unbelievable technological advances occurring every day in chemo and cancer-related treatments. And we need the legislature to recognize, and we need insurance companies to recognize, that these treatments are available and should be made available to all patients in Arizona who have the ability to have insurance, so that oral chemo drugs are treated the same as an IV or an injectable form of drug. The key here is that if it's not a mandate, insurance companies, if they allow the IV drug, would be required to also allow the oral drug. It's not forcing anybody to take on a new type of plan. It just says you have to look at the technology that's happened and attempt to duplicate it within the insurance plan. We think it's fair, we think it's in the best interest of cancer patients, and we think it'll help a lot of people in the coming years. So we're looking for support from the Arizona Legislature, currently on House Bill 2078, a bill sponsored by Heather Carter. Representative Carter is the chairman of the Health Committee, and it's making its way through the process as we speak.